Have you ever wondered if you're a great candidate for a facelift? Or maybe you're wondering, what is a facelift and what's the difference between a SMAS facelift, a deep plane facelift, a vertical facelift? There's so many names and terminologies out there, and in this video, I'm going to help you figure out what a facelift is, which technique is best for you, and what the recovery process looks like. My name is Dr. Karan Chopra. I'm a board-certified plastic and reconstructive surgeon with expertise in facelifts, neck lifts, eyes, and the entire spectrum of cosmetic plastic surgery. I trained at the Johns Hopkins Hospital, and for those of you who don't know what that is, that's the #1 hospital in the world, ranked by US News World Report for over 21 years in a row. After completing my residency at the Johns Hopkins Hospital, I completed further training focusing just on aesthetic surgery, and I have a deep interest in facial aesthetics. It's all I think about. It's what I've dedicated my life to, and my office is as obsessed with it as I am. We've helped thousands of patients achieve their facial beauty dreams through our special techniques using local anesthesia and mild sedation for patients who are just too scared to go under general anesthesia. Our facilities are located conveniently in South Florida in the Coral Gables neighborhood of Miami. We're 15 minutes away from Miami International Airport. We treat patients from all 50 states and 13 different countries. Our facilities are uniquely equipped with the world's latest technologies, and we adhere and exceed all safety standards in our area. I hold privileges at several nearby hospitals, and even my own home is walking distance from the surgery centers that I use, ensuring that you're always taken care of at the highest level. We have relationships with several 5-star hotels in the area to make sure that even our most discerning guests have convenient accommodations close to our facilities. So what is a facelift? Facelift is the gold standard for facial rejuvenation. It improves nasolabial folds, elevates back the mid-cheek, gets rid of the jowls, and improves the neckline. There's no better procedure for facial improvement than the facelift. And there's just so many different terms for facelifts on the internet these days, and I'm here to help you figure out which one is right for you. When facelifts first started, surgeons were just tightening the skin, but that didn't work. It looked great for a few weeks, but it flattens the face and it's prone to early recurrence because skin isn't designed to support your face. It's just supposed to cover the deeper structures. So we quickly moved on to one layer deeper. That's known as the SMAS facelift. The SMAS facelift avoids some of the issues of the skin. It's one of the most commonly performed facelifts. It's safe, it's reproducible, and it delivers great results. In the SMAS facelift, we go one layer deeper, elevate the skin, tighten the SMAS, and then remove any excess skin and close it up with fine sutures. My preference is to go one layer deeper. This advanced form of facelifting releases the ligaments, ensuring a tension-free closure on the SMAS layer and the skin layer. And tension-free is very important because that's what produces invisible scars and long-lasting results. Many surgeons these days are performing either SMAS or deep plane, and it's important that you speak to your surgeon about why they perform the facelifts that they do, and for you to understand why the deep plane facelift is truly the most modern, most capable, and durable solution for facial rejuvenation. So if you're thinking about a facelift, we're gonna have to set up a consultation. Usually for my out-of-town patients, we start with a virtual consultation one-on-one using Zoom. On the call, I'll review the photographs that you've submitted previously. I'll review your medical history to make sure that you're a safe candidate to undergo the procedure. We'll also review your goals, come up with a customized treatment plan, and once we've decided on the exact procedures that you'd like to have, we'll set up a preoperative appointment to make sure you have your medical clearance taken care of prior to arriving in Miami. Patients typically arrive into Miami about 1 day prior to their procedure. On that day, we'll go over your treatment plan, take photographs, review the consent forms, and get you geared up and ready for the big day. So the big day's here. We'll meet at the surgery center around 6 a.m. Surgery starts by around 7 or 7:30 after you and I have spoken. We've performed your markings carefully in the mirror, and we've reconfirmed all the nitty-gritty details to make sure that you're satisfied. All my procedures are overseen by a board-certified anesthesiologist to ensure your comfort and safety throughout the entire process. After the procedure, we're usually done by around lunchtime. You'll head back to the hotel where you'll be having Tylenol level pain. Typically, patients feel almost no discomfort that first day because we use numbing blocks to block any sort of pain. There's no sort of mummy wrap, and you don't have to sleep upright in a chair. All we do is a simple compression garment on your face, and you sleep with 1 or 2 extra pillows to reduce swelling that first night. The next day, you're gonna wake up, you can take a shower, You'll come to my office just to check on everything, make sure you don't have any new questions. You'll go for a walk in the local area. You can go out for breakfast or go out for lunch. Most patients are still not having much pain, just taking Tylenol, drinking plenty of water, and resting and relaxing and enjoying the recovery process. During that first week, you and my team will meet several times. You'll go for lymphatic massages. You'll see me to make sure the incisions are progressing well. And on the 7th day, we'll remove your sutures. And that's the time when patients are typically ready to go home. Typically, there's about 1 or 2 weeks of mild swelling. By the 3rd week, you're feeling confident enough to go out to dinner. And by 6 weeks, you're confident enough to be filmed or photographed for a special event. So how long does a facelift last? Well, in terms of the surgical day, you'll come in the morning, you'll be home by lunch. But what most people mean when they ask that question is, when will I need another facelift or another facial procedure? The truth of the matter is, you never lose the benefit of a facelift. If there were to be 2 twins, one got them, the other didn't, in 10 years, the patient who got the facelift or the twin who got the facelift would still look better, but would still have aged 10 years and show other signs of aging. So while you never lose the benefit of a facelift, by 10 years, patients have typically undergone another procedure. Maybe it's an eyelid lift or a little lip lift or a little laser or fat transfer. So if you're considering a facelift and wondering if you'll ever need one again, chances are you might not need another facelift, but you'll still choose to consider other tweaks as you age to keep aging gracefully and slow down the aging process. So let's take a look at a recent surgery. This is another plastic surgeon, and it's such a huge honor when other surgeons or surgeons' family members seek out surgery with me. This is a 58-year-old surgeon, and she came to me to fix some of the signs of aging that she wasn't pleased with. So after a careful conversation, we detailed her wish list and we came up with a series of procedures to roll back the aging for this patient. Together, we decided on a series of procedures to optimize her facial appearance and rejuvenation. So we started off with facial fat transfer. Transferring fat from the upper inner thigh is the gold standard for revolumizing the face and blending the various subunits of your face back together, blending the lid-cheek junction, smoothing the contour between the nose and the lips, the chin and the jawline, and the lips and the chin. After that was done, we did an elegant pinch upper eyelid blepharoplasty to improve her periocular appearance. I blended the lid cheek junction to get rid of that tear trough and the dark circles. After that, we performed a upper lip lift and a corner lip lift to restore balance and the sensuality in the lower face. And to top that all off, we did our classic deep plane face and neck lift. And you can see here at just 9 days later, she's feeling amazing, looking great, and confident enough to go out to dinner, and she sent me her selfie photograph. Here she is 19 days after surgery with makeup done for a webinar presentation to thousands of other oral surgeons in her community. So if it's something you're considering and you have questions, submit your photographs. Let's have a conversation and let's come up with a treatment plan that fits your needs, that fits your anatomy, your goals, and your recovery timeline. I'm Dr. Karan Chopra, and thanks for listening.